Bismillah ar-Rahman ar-Rahim. Now we come to an important group of anemias, which are hemolytic anemias. As you know, the lifespan of normal blood cells are about 120 days. When the cells come to the end, they are destructed normally in the blood. But in hemolytic anemias, there is immature destruction of these cells before the 120 days. Haptoglobins are normal substances which are present inside the blood. They carry hemoglobin and they go together to the reticuloendothelial system where the hemoglobin are destroyed. Definition of hemolytic anemias. Of course, it results from increased rate of destruction of RBCs, immature destruction of RBCs. There is a huge reserve in the blood to withstand destruction of RBCs before the jaundice appears and before the anemia appears by symptoms and signs, because the body is, or it can be compensate well for the destruction of cells by increased rate of synthesis of RBCs, but this comes to an end and the body can no longer resist the development of anemia if the destruction of cells and hemolysis continues for a long time. The normal adult marrow, after full expansion, is able to produce red cells at 6 to 8 times the normal rate. This is a large power of the bone marrow to compensate for the resistance or prevention of development of anemia. Classification of hemolytic anemias. Mainly, it is classified into two major groups, which are number one, hereditary, and number two are acquired group of hemolytic anemias. We start with the hereditary one. Hereditary one is further subclassified into groups. Number one, hereditary hemolytic anemias due to membrane defects. Examples for these are hereditary spherocytosis and hereditary elliptocytosis. Number two, hemolytic anemias, hereditary hemolytic anemias due to metabolic defects, and the classical example is glucose 6-phosphate dehydrogenase deficiency or pyruvate kinase deficiency. Also, we have hemoglobin defects, and this occurs due to genetic abnormalities. The classical examples are sickle cell disease and thalassemia. Acquired group of hemolytic anemias has various examples. We start with the immune acquired hemolytic anemias, which are further subgrouped into autoimmune, alloimmune, and drug associated. Autoimmune examples of these are warm and cold antibody type anemias. Alloimmune occurs in hemolytic transfusion reactions and hemolytic disease of the newborn, or allografts, especially in bone marrow transplantation. Drug associated has also so many examples. Also, we have red cell fragmentation syndromes and Marsh hemoglobinuria. All these are acquired examples for hemolytic anemias. Infections, the classical example is malaria, also Clostridia bacterial infection, can result in hemolysis. Sometimes chemicals and physical agents can result also